Good afternoon, Tikmikshing residents, community. Welcome to your health Q&A for this week. Today is Thursday, May 21st, and today we have 4 on the panel today. So myself, and then we have Cheryl Thurston, who's our health administrative assistant. And we have Amanda Wapagijic-Jourdain, who is our health promotions manager. And then we have James Bolan, who is who works with Mama West Wing, and he is their addictions and mental wellness counselor. So today we do have some focus on the statistics plus masks, and then James will do a speak about structure and PAWS. Okay, so I'll start off today's session with statistics. So for Tikmikshing and Anishinaabeg, we have 0 confirmed cases and 0 testing. On First Nations reserves in the province, as of May 19th, Indigenous Services Canada is aware of 198 confirmed positive COVID-19 cases, 18 hospitalizations, and 3 deaths. For May 20th, from the Ministry of Health, the statistics are 390 new cases were reported in Ontario today, bringing the cumulative case count to 23,774. This includes 18,190 resolved cases and 1,962 deaths. In Ontario, a total of 567,176 tests have been completed, with tests performed at Public Health Ontario laboratories and non-public health laboratories. There are currently 4,444 tests under investigations. 991 patients are currently hospitalized with COVID-19, 160 are in ICU, and 120 are in ICU on a ventilator. As the Ontario government carefully and gradually reopens the province, those taking public transit, returning to work, or going out shopping are being urged to continue to adhere to public health advice as the best line of defense against COVID-19. To assist the public, the Ministry of Health today released specific recommendations on how to choose, wear, and care for appropriate face coverings used in public where physical distancing is not possible, along with additional safety measures for provincial transit agencies. So basically, the government is really recommending that if we can't stay 6 feet away from people, that we need to wear a mask, and this could be a homemade mask. So the questions, we have quite a few questions, and they're gonna all be around masks. And then the last 3, there's gonna be just some 3 other questions, and we'll start off with Amanda.
Okay,
welcome,
so
Amanda.
Guidance for wearing, the masks. So the guidance for wearing non-medical masks, medical masks, including surgical masks and N95 respirators, are in short supply and need to be kept for healthcare settings. We will discuss the importance of wearing a mask if you're not able to stay 2 meters or 6 feet away from someone.
Okay, Cheryl.
Why wear a non-medical mask? You can wear a non-medical mask, for example, a homemade cloth mask is as an added step to protect others around you, even if you have no symptoms of COVID-19, novel coronavirus. But remember that wearing a non-medical mask has not been proven to protect the person wearing it. It protects other people from your germs.
Okay,
and then
James.
we have okay, thanks, Carmen. What does a non-medical mask do? So a mask acts as a barrier. It reduces the chance of spreading respiratory droplets to others and prevents droplets from landing on surfaces when you cough or when you sneeze. Wearing a non-medical mask in public or other settings is not a replacement for proven measures such as hand washing, physical distancing, and limiting non-essential travel.
When to wear a non-medical mask. So the Government of Canada suggests that you wear a non-medical mask when you must go out in public and can't keep a safe distance of 2 meters or 6 feet from others. So say for an example, when you're at the grocery shopping or at the public transit, if you can't stay 6 feet away from others, then please wear a mask. Amanda?
Okay, and how to use a non-medical mask safely. Non-medical or cloth masks have limits and you need to use them safely. Your mask should fit snugly but comfortably against the side of the base, covering your nose and mouth. Be secured with ties or ear loops. Include multiple layers of fabric. Allow for breathing without restriction, and be able to be washed and machine dried without damage or change to shape.
Using your mask. To use your mask, you must wash your hands immediately before putting it on, avoid touching or adjusting your mask while wearing it, be sure not to touch or rub your eyes while you wear it, don't share your mask with others.
And they also recommend if you end up touching it, wash your hands again. So wash your hands before you put the mask on, and then wash your hands after you put the mask on. James.
And do not place a mask on children under the age of 2, anyone who has trouble breathing or is unconscious, and anyone that cannot remove the mask without help.
Okay, so removing your mask. Masks can become contaminated on the outside or when touched by hands. To remove your mask safely, you must, step 1, be very careful not to touch your eyes, nose, or mouth when removing your mask. Step 2, wash your hands immediately after removing it. Step 3, place your used mask directly into the washing machine. Step 4, wash your mask with other items using a hot cycle and then dry it thoroughly. If you can't wash your mask, throw it in the garbage right away. Learn more about preventing the spread of COVID-19, including how to wash cloth masks and safely dispose of non-medical masks on canada.ca/coronavirus.
How is COVID-19 spread? Human coronavirus cause infections of the nose, throat, and lungs. They are most commonly spread from an infected person through respiratory droplets generated when you cough or sneeze, close prolonged personal contact, such as touching or shaking hands, touching something with the virus on it, then touching your mouth, nose, or eyes before washing your hands. Current evidence that suggests person-to-person spread is efficient when there is close contact.
Okay, Cheryl?
The last 3 questions will not be referencing masks, but other areas. What are the current rules and guidelines for physical distancing? Avoid visiting friends and stay 2 meters away or 6 feet from anyone outside your immediate household. However, starting today, some restrictions are being relaxed, excuse me, including allowing house cleaners, babysitters, and maintenance services. Organized public events of more than 5 people indoors or outdoors, including in private dwellings, are still banned, though gatherings of 10 are allowed for funerals.
So the novel coronavirus can live in water, but is it infectious? The Center for Disease Control and Prevention says on its website that there is no evidence that the virus that causes COVID-19 can be spread to people through the water in pools, hot tubs, spas, or water play areas.
Okay, thank you. What is the difference between quarantine and isolate? So quarantine is, in brackets, self-isolating. Quarantine for 14 days if you have no symptoms and any of the following apply. If you are returning from travel outside of Canada, if you had close contact with somebody who has or is suspected to have COVID-19, or you have been told by the public health authority that you may have been exposed and need to quarantine. The definition or how they describe to isolate. So you must isolate if any of the following apply. You have been diagnosed with COVID-19 or waiting to hear the results of a lab test for COVID-19. You have symptoms of COVID-19, even if they're mild. You have been in contact with a suspected, probable, or confirmed case of COVID-19. You have been told by public health that you may have been exposed to COVID-19, or you have returned from travel outside with symptoms of COVID-19. So that's the difference between quarantine and isolate. Those were fast questions. So now we're gonna move on to James, and James is gonna speak on structure and PAWS, PAWS.
Yeah, miigwech, Carmen. Wabalang Ganandishnikas. And my spirit name is Grey Wolf. I live in Sudbury and I'm from the Crane clan. I'm honored to be here today. And I put together a little something on the importance of structure and understanding of post-acute withdrawal syndrome. As well, I start out a little bit here with talking about fear. So if you're in recovery from addictions or maybe dealing with mental health struggles, these times of self-isolation and social distancing can be overwhelming and quite often unbearable for many. Many of us may be experiencing fear of the virus, fear of the unknown, or fear of our futures, or even if we're going to get through this day. Many fears may come forward as a result of what's going on with this pandemic. My mentor and my good friend, Brian Nuchitai Sr., he's gifted me with some teachings of the medicine wheel where I may visit that doorway of fear in my medicine wheel. However, remembering not to stay stuck there, to come back to the center of my wheel where I celebrate my humanness and my sacredness and acknowledge the doorway of fear that I visited. Give thanks for the visit and make that visit my spirit helper, that fear. This is a powerful way of visualizing and is helpful to ground and to be in the present moment, as well as to help consider and determine the things that I need to do to enhance my overall well-being. Visiting the fear tells me that I'm afraid of something and that my feelings and thoughts around it are real and are to be respected and not minimized. Fear is different for everybody, and the experience of fear is very individual. Not to be compared or judged, but to be respected and to be validated. If you're in early recovery from addictions, you'll likely know and have experienced the dedication that it takes to do the hard and the important work to build structure in your day, in your day-to-day living. That structure, which has helped you keep you safe from relapse or from mental health disruptions, with the onset of the COVID-19 pandemic, it may have introduced unexpected obstacles to the structure that you've worked so hard to build and to maintain that help to ensure you don't relapse or regress. So what can one do given these new circumstances? This would be an optimal time to tap into your own gifts, your abilities, your energy, your creativity, your power, your spirituality, and redefine or modify your structure and what it needs to be so that it continues to work in sync with your continued desire to abstain from drugs or alcohol and to maintain your well-being. In building your new structure, it's important to pay attention to many areas to help ensure that you strive for your necessary balance in your medicine wheel. Remember that boredom is often a trigger to relapse and to regression. Idle time is often referred to as the devil's playground. Your awareness is key to your success. And more importantly, your actions on the awareness will determine the results. Being aware of PAWS, P-A-W-S, which is post-acute withdrawal syndrome, is especially important to be aware of for those who are in early recovery. Post-acute withdrawal syndrome consists of the psychological and the mood-related symptoms that persist and occur after acute withdrawal has been resolved. So acute withdrawal is that initial stage when you first put down the alcohol or the drug. It's that first 2 weeks of withdrawal, and it's referred to as acute. The post-acute withdrawal is what comes afterwards in terms of psychological and mood-related symptoms. PAWS, post-acute withdrawal syndrome, can feel like a roller coaster of symptoms, which come and go unexpectedly. Each episode of post-acute withdrawal syndrome can last from several hours to up to a few days, and these can continue cyclically for up to a year or two. These symptoms can occur as a result of previous use of any intoxicating substance, such as illegal drugs and alcohol, as well as with prescribed medications, including psychoactive medications, antidepressants, stimulants, opioids, marijuana, and benzodiazepines. If you're not familiar with post-acute withdrawal syndrome, I encourage you to do some research on this. It may just help you save your life. It helps one to understand the changes that occur in the brain resulting from the toxic effects of substances that have been used. Post-acute withdrawal syndrome can be just as intense on a person as acute withdrawal and can result in relapse when it's not understood and in an attempt to relieve the discomfort. One might go back to using the drug to alleviate the mood or the psychological symptom they're experiencing. Essentially, post-acute withdrawal syndrome exists until a person's brain chemistry and functioning reaches that state of normalcy or equilibrium during their healing and recovery process. Understanding this helps one in acknowledging and accepting that they are experiencing what they are experiencing psychologically and with their moods. Some quick examples of post-acute withdrawal symptoms include irritability and hostility, depression, anxiety, mood swings, low energy and fatigue, sleep disruption, including insomnia, limited ability to focus or to think clearly, a lack of libido, and inexplicable chronic pain. The following is a list of conditions that can potentially affect the experience of post-acute withdrawal symptoms, in the sense that if you're using drugs, the drug of your choice, it can exacerbate and make the symptoms worse in terms of maybe depression or anxiety. How long, how frequently, and how much of these substances the person is using or uses regularly. Acute emotional issues that arise during the first year of recovery, for example, death, loss, trauma, etc. When you add that and you're already feeling post-acute withdrawal syndrome, it can really increase the effects of what's going on with you in terms of your mood fluctuations. Co-occurring physical and or mental health condition, and also the support provided by substance abuse treatment professionals. So in effect, when you sit and share with somebody and they help you to understand, just as we've just talked about here with the post-acute withdrawal syndrome, it helps you to understand what's going on with you. And when you're able to share with somebody that can relate to that and to help you understand what you're going through, it can be really comforting. Note at the end here, I wanted to add just one thing. There was a time about 7 years ago when I was facilitating a circle, and I talked about post-acute withdrawals, and the one gentleman started crying. He was in early recovery. He was about 2 months clean, and he got up and he said, I think you just saved my life. And he went further to explain that now that he understands what's going on with him because of the fluctuations of his moods and the behaviors, and he could relate it to the post-acute withdrawal syndrome, and he still today is clean and sober and keeps in touch with me. And it's a beautiful thing, because when you understand, it gives you the power of knowledge can help you to make the changes that are necessary. So I really implore you to take the time to read up on post-acute withdrawal syndrome. I also want to ask that please remember to stay connected to your friends and your loved ones and your supports, and remember that you're not alone. Please reach out and talk, and practice activities that contribute to your well-being. And I put a little picture here of that I guess is going to be circulated, but it's about filling up your cup with comfort, self-love, peace, movies, art, reflections, self-care, self-soothing, stretching and exercising, all kinds of, it's just a cute little diagram. But anyways, Chimiglich, for your time, and I hope this was helpful.
Thank you, James. That was, I think it would be very helpful to many people. And if anybody in the community does need to talk to somebody, and James is always available, same with Brian. We also have Jennifer Brito, who's our wellness coordinator, and Tina Nuchtai, who's our other wellness coordinator. And they have posted their phone numbers as well. Okay, so on to the last one. This one here is with regards to the border security. So effective today, the border security operating hours are 7 a.m. to 3 p.m., 3 p.m. to 11 p.m., 7 days a week. Given the recent updated measures to allow for visiting, the border will function mainly to screen residents and visitors, primarily for symptoms or travel outside of Northeastern Ontario, and to advise of the store closures. The revised time frame will capture regular visiting hours and high traffic volume. This will be evaluated regularly and could change upon an increase in COVID-19 transmission rates or risk to the community. So that is this week's health Q&A. I'm really glad that you could join us for this week's health Q&A. And if you do have any questions, please send them to communications@wlfn.com, or you could send them to myself, cnuchtai@wlfn.com, or anybody else on the panel. And thank you very much. Have a wonderful week. Bye.